If you could visualize the communication happening inside you right now, it would look a lot like this network. Every single day, your body processes thousands of routine, localized physical sensations. Most of these signals are entirely normal. It's the dull ache behind your eyes from staring at a screen all afternoon, or a racing heart when you carry groceries up a flight of stairs. We deal with so many of these minor discomforts that we develop a habit of instantly dismissing them. When something feels slightly off, our instinct is to explain it away by telling ourselves we're just tired, stressed, or dehydrated. That habit is usually harmless, but there is a massive difference between everyday physical noise and a genuine critical signal, a specific warning that a vital organ system is actively failing. Treating a life-threatening signal like everyday noise can turn a manageable medical event into a fatal mistake. Sometimes waiting to see if you feel better costs valuable time. To understand which signals demand attention, you have to look at the pattern. A medical emergency doesn't always announce itself with immense, agonizing pain. Sometimes the clearest warning is simply that a sensation feels completely wrong. This diagram shows the core framework for recognizing an emergency. Look for a symptom in the center of 3 categories: sudden, severe, and different from normal. When a sensation breaches this center, it forces you to evaluate objectively, rather than brushing it off. This pattern recognition is incredibly important when observing anomalies that originate from your 2 most vital organs, your brain and your heart. Explicitly defining what your normal physical baseline feels like is the only way to recognize when an unexpected change requires an immediate emergency response. When it comes to the brain, emergencies rarely feel like a localized pain in your skull. They frequently manifest as sudden, unexplainable physical malfunctions throughout the body. This anatomical diagram illustrates the standard metric for stroke detection, the FAST acronym: face drooping, arm weakness, difficulty with speech, and time. Even if physical malfunctions disappear after a few minutes, a temporary episode indicates a systemic failure requiring urgent medical assessment. Other major neurological warnings include a sudden, unexplainable bout of confusion, or the immediate onset of a headache that is completely different and more severe than anything you've experienced before. This is a sharp departure from your baseline. A routine tension headache or typical migraine doesn't strike out of nowhere with a cluster of severe problems like vision loss or trouble speaking. These specific disruptions mean the brain's physical hardware is actively under threat. Every passing minute without proper blood flow becomes a compounding risk of permanent cognitive damage. Moving to the chest cavity, cardiovascular and respiratory emergencies operate on a similar logic. They are often felt as an intense physical restriction rather than a sharp, localized pain. Consider this mechanical compression. A heart attack frequently presents exactly like this: a squeezing, heavy pressure originating in the center of the chest that physically travels toward the arm, neck, or jaw. Severe respiratory threats follow a similar restrictive pattern. This includes the sudden inability to draw a breath, or rapid swelling in the mouth and throat, physical indicators of a life-threatening allergic reaction called anaphylaxis. Medical professionals use the phrase "time is tissue" to describe the biological reality of these failures. If you delay action during a blockage, the result is rapid, permanent cellular death in the heart or lungs. Your responsibility in these moments is not to successfully diagnose the exact medical condition. Your only job is to recognize the severe pattern and immediately trigger the emergency response system so professionals can take over. The primary psychological hurdle that stops people from acting is embarrassment. We hesitate to call for help because we are afraid of causing a scene over a false alarm. Getting a medical evaluation and discovering you are completely safe is a victory. It is the best possible outcome, and it is never a waste of emergency resources. Understanding these signals doesn't mean you have to live in a state of paranoia, analyzing every minor physical ache. It means listening to your body. You learn to respect your established physical baseline, and you act decisively the moment a symptom breaks the rules of your normal bodily noise. Your body is constantly communicating. Refusing to ignore these signals is how you provide your body the help it requires when every minute counts.